Hello, and this week we will discuss the role of leadership in healthcare organizations. We will explore the different factors that influence organizational structure, culture, politics, and power. The unique American political and social outlook has influenced the development of American healthcare organizational structure. Most nurses today works as employees, so it is important to look at the types of health organizations that exists. By the end of this lecture, you should be able to meet the following objectives. Identify and compare characteristics that are used to differentiate healthcare organizations. Analyze economic, social, and demographic factors that drive the development and classification of healthcare organizations. Explain the implications of healthcare organizational evolution for nursing leadership and management roles. Analyze the relationship among an organization's mission, vision, philosophy, and structure. Evaluate the forces that are necessitating the re-engineering of organizational system. Evaluate the use of the concepts and principles of culture, cultural diversity, and cultural sensitivity in leading and managing situations. Distinguish between the varying types of power in the exercise of nursing leadership, and finally, choose appropriate strategies for exercising power to influence the politics of the work setting, professional organizations, legislatures, and development of health policy. There are three major institutional providers. These are the acute care hospitals, long-term care facilities, and rehabilitation facilities. Even though many positions have evolved externally from hospitals over the past few decades, hospitals remain the largest employers of nurses. There are key characteristics that describes the different healthcare organizations. These are the types of services provided, length of direct care services provided, ownership, teaching status, and accreditation status. The types of services refers to general or special care. The care further may be described by disease entity or patient populations. General services have broad spectrum populations and diseases they care for. These include community health care departments and general hospitals. Specialty care may be age-related, such as elder care or pediatrics, gender-related, such as women's health service, or disease diagnosis-based, such as psychiatric or burn or oncology. Further discussion about the types of services is also discussed in the next slide. The second differentiating character for health organizations is the length of care. The length of care is focused first on episodic and distributive care. Distributive care is the ongoing care that isn't precipitated by some event or condition. Episodic care could describe acute care facilities. Acute care typically refers to stays expected to be less than 30 days. Chronic or long-term care refers to services expected to be longer than 30 days. Note that in order to provide well-integrated care, many organizations have acute care hospitals, long-term care facilities, home care services, and rehab services. The third differentiating factor in health organizations is the ownership of the organization. Ownership type is discussed next in a separate slide. Another factor is teaching status, which refers to whether the organization is affiliated with medical and or nursing school. As you may know, teaching institutions have different missions and resources than non-teaching institutions. Teaching institutions have access to the state-of-the-art research, technology, and sometimes quality care providers. The quality of care and cost in teaching institutions is usually higher. And the last attributes or differentiating factors among the organizations is the accreditation status. Accreditation of the organization is another factor that determines the quality of care. The Joint Commission on Accreditation of Healthcare Organizations is the national organization that develops standards and accredits healthcare organizations. The Joint Commission initially emphasized standards for how hospitals should be structured and set up for accreditation. It has broadened its approach and identified patients and organizational outcome to be reviewed for quality. Accreditation is one of the ways hospitals can be certified to receive Medicare and Medicaid payments. As previously discussed in the previous slide, the types of services provided is further expanded in this slide. The care services provided in health organizations are typically described on a continuum of health care from wellness to illness as primary, secondary, or tertiary care. Primary care emphasizes the promotion of health and prevention of illness or disability. Secondary care emphasizes detection and early intervention in illness to prevent further illness and disability, while tertiary care provides restorative or rehab services for patients with chronic or irreversible conditions. Ownership of healthcare organization is another characteristic that determines the legal, business, and mission entity of the organization. There are three main ownership types of healthcare organizations, and these are publicly owned, private non-profit owned, and for-profit organizations. The public healthcare organizations include tax-supported agencies at the federal, national, state, and local levels. The boards of these institutions are appointed through political processes and are responsible to elected officials and taxpayers. The private nonprofit institutions are controlled by voluntary boards and often have a mix of paying and charity patients. The excess of income over expenses is never called profit in these organizations. The excess income is redirected into the organization to further its mission. The for-profit institutions may have a paid board of directors, and the institutions are owned by individuals, partnerships, corporations, or multi-systems. The key point is that their excess of income over expense is known as profit and is available to stockholders as dividend. This type of institution may also be called proprietary or for-profit organizations. Healthcare institutions' existence, growth, and development is derived by many factors, mainly economic, social, and demographic factors. In regards to economics, we often read in the papers and online news that the percentage of the gross domestic product devoted to healthcare continues to rise. We also see a growing population of people needing healthcare services. whether through survival of people who a century ago would have died, through increased population numbers, or through the changes in employment benefits. There are also general factors such as inflation, which makes wages and products more expensive in healthcare and thus may influence people in their choices about spending. Finally, there is a direct reduction in governmental payments that influences how organizations can operate. The other force is social force. Social forces is the next area. As baby boomer generation retires, they are likely to become activists about the conditions and quality of services in healthcare. Patients in general are becoming more proactive and often come with predetermined diagnoses and treatment plan. The issue of whether healthcare is privilege or a right has not been resolved and will continue as a social issue. The last force is demographic and geographical distribution of the population and services, which has long been an issue for healthcare organizations. The struggle of rural hospitals to survive and the intensity with which rural communities recruit a primary care provider are two examples of how geographically distribution is a force in healthcare delivery. Disparities of care based on income is well documented. The numbers of immigrants in the U.S. also poses challenges, especially in terms of providing culturally competent care. Increasing numbers of uninsured populations are clustered around particular healthcare provider organizations. Also, we already are aware of the influence of the elderly, both from the numbers who will expect services and from their activism. Think of a local healthcare organization. You may be able to see how these forces mentioned above earlier play out directly in shaping the services provided, the hours of access, the cost and availability of products, and so forth and forth. The organizational designs are often classified by the following characteristics: by their complexity, formalization, and centralization. Complexity concerns the division of labor, how specialized that labor is, the number of hierarchical levels, and the geographic dispersions of the unit. Divisions of labor and specializations refer to designation of processes into tasks. An organizational chart is a graphic representation of the work units and the reporting relationships. Hierarchy refers to the lines of authority and responsibility and how distant the patient side nurse is from the chief nurse officer and the chief executive officer. Chains of command refers to the hierarchy and is the vertical view of organizational charts. The other characteristic is formalization, which refers to the amount of structure an organization has in terms of rules or policies. Often, highly specialized organizations with lots of professionals have little formalization. And finally, centralizations, which refers to where decisions are made. If everyone has to ask someone else, the organization is highly centralized. If the organization is highly decentralized, each employee is charged with decision-making authority to provide the best in-patient care. Highly centralized organizations delegate responsibility without authority to act. The patients at the bedside Patient side nurses or the bedside nurses are often frustrated with this approach uh, that mentioned later, the centralized approach, because they see the decisions to be made evolving as care is being provided. Every organization has a centralized way of administrating its system. In this slide, you can see some of the advantages and disadvantages of the bureaucratic organizations. For example, some of the advantages is having clear lines of authority, defining responsibilities and rules, task specializations, technical efficiency, and promotion based on competence. Some of the disadvantages of the bureaucracy is predisposes authoritarian leadership style, using rewards and punishments, results in competition, faceless decisions, lack of flexibility, and so on and so on. Some organizational structures are classified in different types. These types are functional organizational structures, service line structures, matrix line, and flat structures. The functional structures are the ones organized around specialties. If you can see in this slide, on the right hand, upper right hand, is a figure that resembles a functional structure. As you see, in this structure there are specialized units like surgery, pediatrics, medicine, and obstetrics. On the other hand, the service line structures or product lines focuses on the various functions to produce a specific service or product. In the lower left hand, you can see a figure that represents a service line. As you can see, for a cardiovascular service, for example, there are different services or service lines that are involved in order to achieve the main required service, which is cardiovascular service. These involved lines of services are the cardiac clinic, cardiac cath lab, CCU, tele unit, rehab unit, and cardiac surgical unit. The matrix structures are complex and integrate both functional and service considerations. The manager of a matrix structural unit reports to both a functional manager and a service line manager, as the figure on the left side depicts that matrix. And finally, the flat structure organizations focuses on the delegation of decision making to the professionals doing the work. They have full authority to take these actions without seeking input from others. You can see on the right side a sample, a flat structure where the staff nurse have a direct connection with nurse managers. Another type of organizational structure is called the shared governance. Shared governance is well documented in the literature. It is found in many hospitals that have achieved magnet status because it ensures that the person closest to the issue is always the one solving the problem and then converting the system. These may be called professional practice models. Shared governance is the sharing that occurs between nursing management and patient care nurses so that nurses are accountable for all nursing care decisions. Nurses at every level play a role in the decisions that affect nursing activity throughout the system. Nurse managers move out of traditional industrial model roles into collegial models, becoming moderators of the service process, usually defined by a structure of rules or bylaws. The shared governance is usually defined by a structure of rules or bylaws. We often hear that the term organizational culture. Here's what it means. I know you have all been in some organizations where you had an instant feeling about its formality, concern for others, beliefs in the mission and vision, and so forth. When the behaviors match the values, managers rejoice, and people are living the mission. And so the idea of what is printed in is clear in the care delivery. When the behaviors don't match the values, there's much work to be done. This dissociation between the written words and how people actually perform makes everyone uncomfortable. No organization is going to rewrite its mission to match what is evident in behavior. So it is clear that it takes considerable effort to change people's attitudes and behaviors to match the organization. In general, when such discord exists, the employees need assistance in knowing what the mission means or some organizational practice that is seen as hypocritical by employees must change. The values and beliefs and how they are enacted are also evident in the characteristics of organizational structure. The organizational structure is difficult to understand because of the size and complexity of the organization, because culture is different greatly in philosophy from person to person or organization to organization. The organizational culture is called the soul or personality of an organization. A constellation of rules, forms, and values determine the organizational structure. It is important as a nurse to understand the basic concepts of culture. Understanding the principles of culture will assist you understanding how people shape their behavior, control individual responses to each other, and shapes their outside world's perception of the organization. These basic concepts include they develop over time, their response to its members, and familiarity with social environments. Culture is learned and shared by members. Culture is essential for survival and acceptance, and culture changes with difficulty. It's not easy to change the culture. Nurses need to provide care that is appropriate to the client culture. Some of the terms relevant to cultural principles and care include cultural competence, which is a care that is sensitive to issues related to culture, race, gender, and sexual orientation. Cultural diversity, which comprises a vast range of cultural differences among individuals or groups. Cultural background is a fundamental component of one's external and internal distinctions. Cultural sensitivity involves affecting behaviors in individuals. It involves the capacity to feel, convey, or react to ideas, habits, customs, or traditions unique to the group of people. And ethnosensitive care is the ability to appropriate values, to appreciate values and behaviors within the context of specific cultural norms and to apply this ability to practice. Can you think of some of the things that are direct or indirect coercion in relation to cultural diversity in the workplace? Coercion might exist in the healthcare workplace. Coercion involves the use of power or status. Coercion can be defined as persuasion of a person to act in a specific way or making a change. It could be limits to choices. It may lead to negative consequences or positive consequences. There are direct and indirect coercions. Indirect coercions in relation to cultural diversity might have like for example negative bias toward the minority nurse, negative attitudes in the delivery of patient care. Direct coercions in relation to cultural diversity, for example behaviors, actual occurrence or perception, and intentional or accidental behaviors. Can you think of some of the responses to coercion? Responses could be positive and or negative. Behavior responses to coercion, negative responses like frustration, anger, passive aggressiveness, avoidance, manipulation, being defensive, verbal retaliation, inflexibility, intolerance, and so on and so on. But some of the positive responses to coercion behavior responses could be becoming more cultural sensitive, self-examination of one's personal and workplace values and beliefs and prejudice, finding mutual communication such as respect for differences and honesty, and so on. We are going to turn now to a case study in the next 2 slides. Please read the case study and respond to the questions afterward. In this case study, it discusses a Muslim a nurse that works in an organization, and this Muslim nurse is wearing a hijab. The Islamic dress code of wearing a hijab is considered mandatory for females, for female Muslims. It is a way of life to obey Allah or God. Now reflect on the case study and think about these questions. Does the hospital have policies on dress code that have cultural considerations? Cultural considerations for Muslim or non-Muslim. This nurse could be from different culture. Consider what role does concepts about culture have on this in this case situation. What sensitive or controversial issues are often addressed by behaviors that represent coercion? What might be some potential negative and positive behaviors occurring with the issue of the Muslim nurse wearing of the hijab? Think about some specific strategies might be used to address cultural attire within the nurse units and with other departments. The role of leaders and managers is very much influenced by the types of and dynamics of power and politics exerted and formed within the organizational structure. It is important for nursing leaders and managers to understand the key factors that shape power and politics within their organization so they become effective leaders and managers. Power refers to the authority and ability to get things accomplished. Power is the potential of an individual or group to influence the behavior of others. Power is the ability to influence other people despite resistance from the other people. Power may be actual or potential. It may be intended or unintended. It may be used for good or evil. Policy is a plan of action. It's a set of decisions, procedures, or laws. Politics is the process of human interaction with organizations. Politics is the interaction that takes place between individuals, groups, or organizations to make the policies. It is the art of using power effectively. Types of power can come from different sources. They can come from personal source, expert, position, perceived power, information power, and connection. Personal power is based on one's reputation and credibility. Do others consider you as a credible person who always delivered promises? Expert power is based on the possession of knowledge and skills that are needed by others, like having good clinical skills in IV insertions, skills in computer. Position power is based on one's position in the organization. Unit managers have more power than regular staff nurses, so it is a formal power. Perceived power is based on how others view the person. People may view their unit manager as powerful because she or he is very efficient and skillful. Information power is based on person having selected information that is needed by others. For example, nurses might seek you because you have great skills in dealing with difficult patients, or you have great skills in communicating with patients whom English is their second language. Connection power is based on being linked to powerful people like the CNO. It is possible to be powerful and yet not feel empowered. Power refers to action. Empowerment refers to feelings. Empowerment is a process of sharing power. It develops leadership, collegial relationship, and self-respect. Self-determination is one of the concepts that's related to empowerment. It is feeling free to decide how to do your work. Other concepts related to empowerment are meaning, having meaning, impact, and competence. Meaning refers to caring about your work, enjoying it, and taking it seriously. Competence is being confident in your ability to do your work well. Impact is feeling that people listen to your ideas, that you can make a difference. Think of some of the ways that employees can feel empowered. For example, shared governance, enhancing expertise and expert knowledge, participating in professional organizations, collective bargaining, and participation in decision making. Those are just few of the strategies that can empower employees. Here are some additional strategies that you can use to build your personal power so you can feel empowered. Present a powerful image, like self-image, grooming, language, speaking, learning the language and symbols of the organization, use the organization's priorities, maintain a broad vision, being proactive, being visible, believing, being responsible, taking risks, networking, accept criticism. Power is a positive force for nurses. Believing that being a powerful nurse is a professional asset, is a professional asset. It is critical to one's positive professional image. Accept responsibility for your own mistakes and learn from them. This is professional accountability, and it is powerful. Being a risk taker expanding your horizon in nursing. Join a nurse organization, run for an office, or volunteer for a committee. Network, join nursing organizations, and get to work with other nurses outside of where you work, outside of your organization. Take constructive criticism gracefully. Learn to smile. Learn to let destructive or unwarranted criticism roll off your back. And finally, it is important to understand the type of healthcare organization in which you may practice, because that would help you to understand the populations you serve, the availability of physicians, the concerns about the customers and owners, and how forces are likely to change the organization in the future. It is critical to value nursing as a profession, not just as a job, and to view nursing as one's own career, not just a job. Never think of oneself as just a nurse. Never discourage others from considering nursing as a career. Be a nursing booster. Thank you for listening, and goodbye.